Okay, welcome. So we're looking at a patient with FAP, familial adenomatous polyposis coli, and here we have the duodenum. So you see some work's gone on, and the great work, I must be honest, some cold snap polypectomy of a duodenal polyp. Let's make an assessment of what's going on here. So you kind of have to ignore a little bit the injection, but you can see very nicely here, and we can turn the iris brightness down if that's. You can see very nicely here a laterally spreading lesion of the duodenum. How can we, that's much better, thank you. How can we assess where that is? Well, we need to come back. We need to get in the neutral position, like this probably. So when you're going into the second part of the duodenum, now we have the medial wall over here on the left, the lateral wall on the right, inferior and superior. And you can see here that this lesion is on the lateral wall. If we have a look at it, because actually in the duodenum you can much better see lesions once they've been injected, but it's completely regular and doesn't have any kind of irregularity of the pattern. You can also see there's multiple other smaller lesions, all colonal perforations of duodenal polyps. So this is what they look like. This is what they look like under white light. This is what they look like under LCI. So they're certainly standing out more here under LCI. And then this is what they look like under BLI. And when you get in with magnification, you can really see the microstructure of them. Actually, sometimes quite difficult to determine what's a polyp and what's the background, because you can see that the background of the duodenum. So there are multiple morphologies of duodenal polyps. This is one of them. This kind of brain-like structure, very white on virtual chrome endoscopy, highlighting the hemoglobin. The very white brain-like structure, and the other type of polyp that you find in the duodenum kind of looks a bit more brain structured, if you like, and you can see that it's not quite so white in virtual chrome endoscopy. Okay, and then the other thing that we want to get from this is what about the papilla? And so now let's turn off virtual chromo. And then let's have a look. You can see here evidence of a previous cold snap polypectomy, a little bite out of that fold. But you need a cap, and we need to look for the major and minor papilla. How do you do that? Well, you go and you then gently pull back using the cap. So already we found a polyp here. We keep pulling back. We keep pulling back. And then this is probably the area of interest. So of course, it's always on the medial wall. And you need to know what your orientation, so you need to get good at practicing that, and then you need to go slow, and probably sometimes you need to use water. So we saw it just under the lip there, for sure. You might be thinking, well, what are all these other nodules and why is it so flat here? So this patient has had a resection of a ampullary laterally spreading lesion, I think, not just an ampullary lesion, which extended down here. So now directly ahead in the paused image, you see a little nodule of regenerative mucosa, probably not polyp. And then you see a scar, and a scar is where that fold coming in from the 9 o'clock stops. There's something, nothing, and then the fold restarts in the 3 o'clock. So that is what a scar looks like in the duodenum, not like the colon. They're much different, as in they don't have that pale appearance that the ones in the colon have. And then as you're coming back here, right, we can't get in here. So what can we do? What techniques can we do? Well, we're quite insufflated in the lumens, so we can desufflate a little bit, maybe. And then we can just investigate this zone maybe with water to get onto that area, because I don't think we saw the orifice yet. And as we're using water, maybe it's possible to get in here, maybe not. Because I think that it's up here. So here we go. You can see the orifice very clearly in this image now at the 12 o'clock. And you can also see polyp around it. So this is recurrent polyp after an ampullectomy procedure. It's relatively common in FAP patients. You can clearly see the orifice going here from the center of the screen up to the 12 o'clock. What does this look like in virtual chrome endoscopy or BLI? Looks like this. So the zoom can come off 1 to have a look at the surroundings nicely. Can you see how water in a cap really allows you to obtain this imagery? So now we can see the imagery at the 6 o'clock of this area, but not really higher up. And then maybe we can back off enough to see it there. But this for me is clearly some sort of recurrent lesion here at the 12 o'clock. And the question is what to do about that. The course of ampullomas and ampullary recurrence in FAP is very benign. And I think we're increasingly recognizing that. and the treatment is very invasive, particularly now to treat this recurrent disease here. So this needs to be properly discussed up front with the patients. What are the options? Of course, the options are endoscopic reattempt, surgical otomy reattempt, and full-on surgery. Anyway, so that's how to look for that. And the final thing is, where might the minor papilla be in these patients? Well, if you take the reference of the major, then you need to come back in the 12 o'clock orientation. And often you can't see it. So it would surprise me if we can find it. Usually you find it if it's dilated, but that's the orientation that you're looking in. So if the major, is at the medial position, then the minor is more proximal or more cranial and superior. And I won't waste your time by looking here. All right. Well, I hope that was useful. Thanks very much for watching.